Hello, hello. Supply relationship management. Hello, good evening, Dhanaseka. Is it audible and visible also?
Yes, sir. It is audible and visible.
Okay, thank you. So, in this course, we have come to the topic known as demand forecasting as well as managing the inventory of the hospital. So, demand forecasting is a separate topic, and inventory management is another topic.
Okay.
So, let's now begin the session.
Shall we wait for some time, sir? Because I think no one has
Oh,
joined.
but if they want to see the recordings afterwards, then probably they can watch the recorded session.
Fine, sir. Fine. Sir. Yeah, you go ahead.
Okay. So we'll see the importance of operations management in healthcare. As we also seen previously, operations management in healthcare ensures a efficient delivery of services while maintaining patient safety and quality. So it optimizes the resource allocation, reduces the waste, and improves the patient outcomes. From hospital workflows to outpatient clinics, effective operations directly impact the service availability and cost control. So, operations management helps us in order to increase the scalability during the peak demand or during emergencies as well. This module lays a foundation for understanding how daily operations influence healthcare delivery and how it affects the financial sustainability. So, let's try to see the key challenges in healthcare operations. Healthcare operations face unique challenges such as fluctuating patient volumes. So suddenly there is a spike in the volume, or suddenly there may be very few patients. It also faces regulatory compliances to meet the standards and various the bodies for regulation. And most often, it also faces challenges of staffing because the properly skilled staff are not available or they are in shortage. And apart from that, you also face supply chain disruptions and technological integration issues. So these are some of the challenges which the hospital organization face. So patient variability makes planning difficult because every patient has a different set of needs, especially in acute care settings. The personal attention has to be taken with great care and effort. And alongside budget constraints and rising costs pressure the operational efficiency. So care has to be taken additionally. The data silos, that is very late and compilation of the data and inconsistent reporting hinder real-time decision making. So addressing these kind of challenges require a strategic approach as well as a data-driven approach to the operations management. So let's now try to understand the importance of forecasting in our field. Forecasting helps to predict the future patient demand to guide the staffing as to how many daily staffs are required or on a different seasons, how many staffs, both regular as well as casual, and also visiting staffs are required. So it also helps us to arrange the equipments and supply planning of all these resources. Inventory management helps to properly take care of the medical supplies which are available without overstocking and shortages also, because these two extreme conditions of overstocking and shortages, uh, both are possible if proper planning is not done. So together they reduce the operation costs and improve the service delivery, and it finally has to enhance the patient care. Accurate forecasting enables proactive planning for seasonal surges and also during emergencies and public health events, whereby some campaigns are undertaken either by the non-governmental agencies or as well as NGOs and as well as governmental agencies. So sometimes such public health events are also requiring so much of planning. So this module introduces the core principles that underpin both forecasting as well as inventory systems. In fact, there are two different chapters if you go through the syllabus. But here in this class, due to shortage of time, I'm considering both the inventory management on one hand as well as forecasting on another hand. So let's try to understand what is demand forecasting. So demand forecasting is nothing but it estimates the future patient volume, that how many patients are and footfalls of the patients are likely to happen, in a given period, let us say 1 quarter or 2 quarters or upcoming month or 6 months over a period of time, and that is based upon the historical trends. So we have to mix and match and try to see that what is the likely spike in the demand for patients visiting the hospital, and also we have to see that in what season what kind of patients are likely to visit with what kind of problems. So these keeping of this record as well as external factors will make us more prepared in order to handle the demand. And why it matters in the healthcare, because it involves a lot of analysis of the data from the past admissions in the hospital as well as appointments taken by the people and clinical records to predict the future needs. So what are the key components of forecasting means? First of all, data, and how this data fits into several models, and what kind of judgment the top management have to take in terms of analyzing this data. So data inputs will be data include like patient records and how many visits are there, admission rates and readmission rates, also seasonal patterns and demographic trends. This demographic involves, of course, classifying the patients as per the age, as per the gender, as per the region, as per various characteristics, including education, health, of course, and ability to afford the care which is offered by the hospital. And modeling process can include statistical learning techniques as well as machine learning techniques to generate the predictions with confidence intervals. You can have mean, median, mode, regression, coefficient, correlation, so many other steps. As we normally understand statistics, the same things will be applied for any data. And these days it is more easier because of AI applications. So modeling will become more easier for those who are acquainting themselves with certain applications. Let's now try to see the importance of forecasting in healthcare decision making. Accurate forecasts follow the hospitals to make informed decisions for all the kinds of processes, including staffing and equipment allotment and budget allocation. So they reduce the overstaffing and underutilization of resources. Both are important because sometimes investing heavily in equipment and not using it also is a waste of money, or overstaffing and not giving them a particular set of readiness without proper skills in training is also not equally invited. So forecasting supports in emergency preparedness, how well we are equipped, such as the best in case example would be pandemics, or even in case of natural disasters, how people are united, how they cooperate and coordinate with various departments. It also improves patient flow by preventing overcrowding at certain places. They have to reduce the crowds, and also long waiting times can be reduced. Ultimately, it strengthens the entire operational ecosystems for healthcare delivery. Then, role of forecasting in healthcare service quality and efficiency. So, one obviously should be the service quality enhancement. So, forecasting helps all of us in hospitals to understand how many beds are required, how many staffs are required, how many medical supplies are required, and helps them to plan in advance. And operational efficiency could also, it reduces the patient waiting times and improves the access. So because there is a layer by layer in certain hospitals, only the doctors are given too much of importance. In certain other hospital, only nurses are given. So it could be tilted towards one kind of people. So it should not happen. There should be a balance, because like you can have assistant physicians, a layer which is completely missing. So they are starting some assistant physicians course in Navi Mumbai and places like that, because somebody has to be there in between doctors who keep on visiting only once in a while, like once or twice in a day they visit, and nurses they are there, but one layer is entirely missing. So operational efficiency can be gained importance only if access is done through better planning. And how forecasting supports hospital capacity decision making means resource planning and capacity allocation. So forecasting helps to plan the bed capacity, like 100 bed capacity hospital or 150. How many ICU units are there in the hospital? How many surgical theaters are there? Okay, then ICU units are there. And ICU for newborn babies also ICU units are there. Then expected demand in all these units have to be forecasted. So resource planning and allocation helps to avoid under capacity utilization. So on Sundays or some days without taking apartments, it could be time is wasted by keeping them empty, so which leads to patient backlogs, or sometimes it overcapacity can also be faced over a period of time, which results in wasted resources. So by aligning physical infrastructure with the demand, what is there outside, because how many people are there outside, and cannot be easily predicted. So that is the most important. Hospital capacity will not change; it will remain as it is. But how many people are there outside, and they have to be aligned with as per the various appointments which has to be given to them. And hospitals improve the patient outcomes and reduce the operation costs also while doing all this. So this is especially critical during seasonal peaks or public health crises. And financial planning and budgeting applications are also involved in this case. So in forecasting as well as in managing inventory, budgeting is very important. So accurate forecast, as long as everything is accurate in terms of forecast, it helps us to create a realistic budget. Otherwise the budget will swing one way or the other. So some people say it is over budgeting certain departments than others. So budgeting also has to be equal in terms of how much of money has to be distributed for various departments. And of course it will be within limits only, because uh, most of the larger hospitals are able to make themselves more profitable. But however, some smaller or middle sized hospitals have been witnessed, the research says that they are not as much as profitable as compared to the larger hospitals, because of the very bulk of the patients volume which they are visiting. So enough care has to be taken in especially the smaller or tier 2 town hospitals. So they help predict revenue streams and manage cost centers effectively. Forecasting supports long-term financial stability. So if anything goes wrong in forecasting, then that is going to affect all the people, including HR, including people in the revenue or accounting department and finance department. So entire thing is based upon accurate forecast. The more accurate the forecast is, the more better it is for planning over all the staff members, right from the doctors, nurses, and the supporting staff of various maintenance, engineering, HR, okay, and all other assisting staff members. So it helps to identify the shortfalls or surpluses. So it enables a better investment also in terms of decisions in new facilities, like how many new facilities are required. So everything has to go smoothly by accurate forecast, and upgrades on the projected demand has to be thoroughly chalked out much in advance before anything is rolled out. So workforce forecasting means managing staffing needs. Okay, so forecasting basically is nothing but estimating the real number of nurses required, the total number of doctors required, support staff required at different times. It also counts for how many there in the morning shift, afternoon shift, evening shift, break shifts, how many holidays are there throughout the year, and seasonal variations also. Then this prevents burnout by ensuring adequate staffing during the peak seasons. It also helps to have the retention, so that people will not leave this hospital for better prospects or better looking for better salary. They will not shift on to some other better hospitals without telling. So what is happening is retention and taking care of them becomes a much more challenge in order to know. And if forecasts are good, more retention can happen. Workforce forecasting is essential for maintaining high quality care and compliance with the labor regulations. So timely payment of PF for salary or ESA and all other uniforms or food or whatever it is. So all the labor regulations has to be normally followed. Otherwise, people have to manage with lower aged people or younger staff who are not very much keen on expertise or utilizing them or giving value to the organization over a period of time. So longer the people they are going to retain, it is better for the hospital only over a long period of time. So managing seasons and emergency demands, let's try to see. So hospitals use forecasting to anticipate spikes during flu season. Okay, especially if there is some viral going on, if there is any kind of pandemic going on, or especially during sudden changes in temperature, or hot climatic conditions, or warm weathers, or sudden unexpected changes in the weather forecasting. So these are the times which one has to be sensitively able to take care of seasonal demand management. And emergency preparedness is another thing, with rapid and scalable forecasting models ready to meet all the transportation requirements, additional rooms, able to cater to the existing population around. So, of course, everything has to be done within limits. No hospital can say that it can take care of the entire population around, but whatever is within their means, they can try to mix and match allocation of resources with the people who are able to do that. So, public health and policy planning. Forecasting supports public health agencies in vaccination campaigns also. So, as and when the polio vaccination or various types of vaccinations for children and everything during health interventions, It informs that policy decisions on healthcare access has to be there for all, and funding has to be there for that. So both private and public have to come together. They should also try to know what infrastructure development additional requirements can be allocated or at least subsidized, so that all these will help in policy planning and its application. More important, just planning is not enough. Of application is most important. Predictive models will help identify the vulnerable populations, locate the resources equitably, national and regional health strategies. So, understanding all these non-accessible areas or remote areas which are far flung away from the main cities, and trying to reach out, encouraging the doctors to work there at least for 1 or 2 years after they complete the degrees, and arranging some kind of facilities for them so that they will also feel better in working in rural areas. All that becomes important for not only public health professionals but also people working in the private sector as well. So types and methods of demand forecasting is there. First is predictable demand. Second is unpredictable demand. So what is this predictable demand means? It follows consistent patterns. What has happened last year or this month in last year or this week in last month? All these patterns are naturally available. So one has to gauge and try to observe those things like weekly outpatient visits and all. Once you gauge the thing, then we'll be able to allocate the resources as much as there is an increase in demand. So you have to match with the demand, the supply is what is there internally, and you can raise a request for the upper level managers to say, so allocate resources as much as man, money, material, machines, man, or everything. So this will help to manage predictable demand. However, in some cases, when unpredictable demand is there, which arises from sudden events such as accidents, okay, or outbreaks, not much can be done. But readiness and preparedness has to be shown, because even the doctor has to work on the tools sometimes during late hours, and they will have to uh, take out any kind of unpredictable, surgery or any kind of treatments as and when it occurs. And then we have to see qualitative methods overview. Qualitative methods rely on the expert judgment. So people over a period of time they can use their domain knowledge by interviewing, talking to some professionals, and using the scenario analysis as to what, or even simulation analysis these days, as to how much of historical data do we have? Do we have a 4 year data or a 5 year data within our hospital? How old the hospital is, or since how long the nearby hospitals are there? And when forecasting involves new technologies, anything has been introduced over a period of time, at least 1 or 2 years, recent ones. So these methods are especially valuable in early stage planning. So these early stage planning will help us to cope up with sudden changes, and we also know that we can have a little bit of track on what we are. So we can help to overcome the uncertain environments, while less precise and then quantitative models are there. Okay, just measuring the quantitative may not be just enough. So one has to look at the qualitative aspects, and they provide strategic insights, actionable insights, which they help build consensus amongst the stakeholders. The stakeholders are the same ones, the promoters, some people who have established hospitals, the MD, the CEO, the board of directors, as well as the patients, the nurses community, entire workforce who are taking care of the hygiene and cleanliness, and entire people who are also on casual labor, and those who are on gig work, and everybody who is visiting staff, all are stakeholders for them. So one should not treat anybody else as outside the organizations, including the patients. They are a part of the organization. So there has to be equal treatment among, and there should be a consensus amongst what is their say, or what is their opinion. You have to collect their opinion, collect their feedback, and try to understand what is that they intend to seek in terms of how well the things could be managed. Then comes your expert opinion and Delphi method. Expert opinion is nothing but having some kind of clinical setting, providing insights of how well some things can be improved, even marginally improvement of talking to the patients and ask them a little bit of one-to-one discussions can also help. A little bit of interviewing and survey will also help. And there's like expert opinion will a lot of advice can be taken from people who have worked in the healthcare sector for around 25 years, or many people who know the in and out of the industry. Those expert opinion has to be sought for. Second is Delphi method. The Delphi method uses iterative rounds of questionnaires. So questionnaire after questionnaire could be sent to multiple people, maybe 200 or 300 people, to reach a consensus, and it will give a graph, as to what could be the best area and what could be the suggested mode of handling the patients and workflow and operational administrative areas to improve upon ourselves. So people are there apart from the consultants who will help us to improvise upon both inventory management as well as forecasting also. So, in case of demand estimation, market research collects the data from the patients and also from providers. Sometimes it can be done throughout the entire community surveys, and we can estimate the demand. It also helps to understand the patient preferences. So, what kind of preferences are there? What kind of rooms do they require? What kind of access or barriers they faced while approaching our organization? What kind of problems or pain points are there in terms of service utilization? Whether people were able to handle them cautiously. So these data can be used to handle how the prediction of forecast can be dealt with qualitatively in terms of new services or underserved areas where newer additional, like for mobile van or mobile physiotherapy unit or a mobile dental unit or a mobile ophthalmologist. Sometimes these days all these accessories or sometimes helicopters or even these days chartered flights are also used. So one has to have access to not merely the cabs or the kind of people pick and drop facilities done by the people, but also extension of the hospital beyond a particular limit. So it's also possible provided investors are interested in order to know its outcomes. So while not exactly precise, all these things may not be exactly, the market research may not be precise, but it adds value in the context of forecasting these models, and especially community health and rural settings. And you have quantitative methods. So we have seen that there is something known as the time series techniques. So time series models like SPSS software, they use historical data to identify the trends or cycles happening in the society. So there's also known as regression analysis. So regression models use variables like age. They use what kind of age people come up with what kind of a problem. Like suddenly we have seen in some parts of Karnataka, there is a in Mandya district, there is a sudden outbreak of heart attacks faced by younger population somewhere in the age group of 32 to 35. People were not able to relate it to something why heart attacks are done, faced by the hospitals all of a sudden. What was the cause behind it? So understanding the cause behind why it's happening and what kind of solutions are we likely to emerge and come up with. So and during what season it is happening. So understanding the overall broad overview of quantitative methods have to be understood. We may not end up with understanding the qualitative results suddenly because we may not get the answers, but then identifying and doing research over that and trying to understand and predict the demand and what locations it's happening is most important. So regression analysis has to use those variables that what affects what. Like we have known that certain age group people are facing with certain kind of um, experiences over a period of time, and during certain seasons some other ailments or illnesses were affecting, and so we should try to relate all these things: age, season, versus location. So once you understand, then we'll get some kind of overall understanding about what is affecting what causes what. Okay, so this correlation is very important. For instance, in an area where people are drinkers are too much, the more likely they are fatal accidents happening nearby. So one has to know that how a particular location affects a particular kind of habit or a particular age or youngsters or let us say school and college population, what kind of issues they are likely to face and what kind of seasons it happens. So all these understanding this will require a lot of data analysis and helps us to see the forecasting much in detail. And then what we know essentially so far about the time series is it uses historical data to detect the patterns of seasonality. It identifies trends. It identifies the cycles of how it happens. Regression models analyze the relationship between demand factors like how the population growth in a certain area, whether they are all of them are insured properly or some of them are hesitating to insure themselves, or what are the economic, what kind of social strata they are coming from, and why there is an economic data. What is the limitation beyond which insurance is being not sought after. All this data will help us to understand for the hospitals that how far they'll be able to emerge in terms of handling the patient volume successfully whenever there is a supply needs for them. So when combined with the data cleaning and validation, they offer reliable and repeatable forecasts. So unless and until we know that all these things backup is there for the stakeholder like patients, we may not end up getting the entirety of the information in terms of the data presented. So time series and regression techniques are always being useful in this context. Then we also have simulation and hybrid forecasting methods. So the simulation models these days, they mix and match, just like how you're playing the video game, such kind of simulation, how the patient is moving around in a particular hospital, what kind of facilities he gets. You have to create a profile of a patient moving at least systematically in terms of a dummy patient moving around here, and how many times the hospital staff is being in touch with him, how many times they are conversing with him. And we have to create a real world scenario in terms to test various kinds of conversations which are likely to happen at every point of time. So we can have a flow chart and uh, particular demand outcomes and what is their demand in a various part within the hospital is also equally important. So internally, this what we can see is hybrid methods, which combines the qualitative and quantitative approaches to balance the accuracy and the judgment. So having said that, for instance, a hospital might use a regression model for baseline demand to just to see what is the baseline demand and add expert inputs on those demands. And for rare events, so they can discuss with expert input. They can seek the expert input in terms of during a rare event what kind of adjustments needs to be done by the hospital. So not all of them are not experts. We may think that some are experts, but then it requires uh, adding expert inputs from certain professional people only. So these methods are especially effective in complex dynamic healthcare environment. Then compare to qualitative versus quantitative forecasting. So we are basically knowing the limitations, that is objective scope and limitations and methodology of how we can see uh, it is going to help us. So quantitative normally is always data driven. Okay, there's nothing IQ or EQ being used. Whatever data is there, based upon data, the decision is being taken. It could be objective also, and you have to fulfill some objectives because of certain standards, like what percentage of population have to be covered in a given area, or what type of sampling, what is the target you have to cross, especially in particular survey, and whether they're repeatable. So these are quantitative forecasting methods. So once you spread it across a word of mouth survey, or even in terms of you take some kind of Google forms and fill it up, we know what are repeatable, what are not repeatable, especially the kind of programs like health, vaccination, immunization programs which they come up. Whereas in limitations, if you see, they rely on the historical data. One is either what has already happened or what is happening now, or one has to be ready for forecasting techniques, which sometimes the historical data may lack the insight because they have not asked the proper question to given set of people. So they lack the insight into sudden changes which is happening. So as we have seen that there may be kind of medicines which may not have developed over a period of time, or it takes time. A lot of R&D investment has to happen in order to come across certain dealing with human behavior, because the humans are unpredictable highly. They may or may not likely to accept any scientific changes or advancement which is happening in the scientific field. Of course, the despite doctor being insisting on certain things, it is not done unilaterally. It cannot be done. So people's habits and behaviors and the trends have also to be studied, and what kind of human response is emerging out of all those things is nothing but there are some limitations to the human behavior. So we cannot take it for granted that it could be done mechanically. It should be done with a lot of empathy and trust between the stakeholders. Next is quantitative forecasting tools and techniques, like ARIMA is one method. Probably if you have time, you can go through ARIMA models, and you can there are various applications in ARIMA. And over a period of time, even AI is helping you to understand how ARIMA is. It requires a separate, maybe around 4 weeks course maybe there for ARIMA. And there is also known as exponential smoothing and machine learning algorithms which are used in quantitative forecasting. So these three concepts are being utilized once you know what is exponential smoothing and what is machine learning algorithms which we normally come across suddenly that it takes very less time. They are applied in predicting patient admissions and medication usage. Okay, they have to track all these medication whether they can use on their own or they have to insist them on using it, and all those things. So what motivates them and what kind of equipment do they need, what kind of devices or medical equipment they have to purchase on themselves. These models are ideal for stable predictable environment. Okay, so in order to create stability, otherwise everybody will be having a lot of anxiety because the hospital area is something which is there, everybody is anxious, nobody knows what to do. So that's the whole issue. So understanding quantitative forecasting tools and applications are always, one should be always able to know ARIMA, exponential smoothing, and machine learning. However, they require cleaning of the data and cleaning of the data, and so because some data are missing and some are not reliable, so they may fail during unexpected pandemic. So we cannot apply the same thing as a general solution during pandemics and natural disasters. Whenever there is stable, predictable environment, one can have quantitative forecasting in knowing whether there are regular admissions into the hospital, whether there are regular medications usages happening, and whether the equipment needs have to be taken care. So quantitative forecasting will help us in order to overcome lot of planning problems, and you don't have to convince and educate the people so much that every time that what has to be done, otherwise the whole day goes in telling the patients what to do. So everything plan has to be ready, manual has to be created, or you have to create some videos of your own hospital, or you have to educate them, you have to make some decisions of planning of flow charts. So that will solve most of the problem. They should be displayed thoroughly everywhere, whichever possible, wherever possible. Then comes, of course, qualitative forecasting. Role of human judgment is very, 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 very crucial. So qualitative methods on human expertise and experience to interpret trends and anticipate changes. Okay, so we don't know. If you ask a computer, it will give the same answer every time. But if you ask a human being, every human being is different. He will come up with a different answer. So they are especially useful when data is very scarce or when forecasting a new service is required. So 100 people, if you ask 100 people, they will come up with different answers. For example, a hospital launching a telehealth program use expert opinions, but very few experts are there throughout the country. So at that time, we have to estimate the patient adoption. So how many patients are ready to undergo all these things, and while it's being subjective also, at the same time, while subjective also, these methods provide valuable strategic foresight. Okay, it will give you foresight, and you can help to overcome the uncertainty involved in all those things. So people are sometimes, when the data is scarce, when there is less data on all those things about how many experts are there. Of course, there are newer applications that you can take the suggestion, or you can say some prescription. Okay, because every time if you go and take some prescription and try to get some consultancy fees, it is very becoming expensive. So government itself has started that every time you are faced with some problems or illnesses, you can always take a lesser affordable option, whereby integrating all these things on the human judgment. Because the role of you cannot replace human judgment, because it can be used, telemedicine can be used, and even surgeries are done on a distance based upon the patient adoption rates. The facilities or everything has to be managed qualitatively. This has to have based on how you interpret the trends and how people will see it, whether they themselves are not in favor of that or not. That has to be understood in qualitative forecasting. So qualitative forecasting helps us to assure that rest assured that people will take care of themselves with usage of latest technologies. Then comparative analysis, strengths and limitations. First is strengths. So quantitative methods offer precision. What quantitative data gives us is a lot of precision is there and a lot of scalability, but we miss the context once for. Okay, the entire context. Sometimes quantitative data will give you everything. So you can make a entire thesis, or you can make a write a entire book of inputs in that. But once in a while, in what context this has to be, implemented, that itself goes missing. So one has to know the limitations also. And next comes is strengths and limitations. So qualitative methods capture the nuances, means they know the minor detail or very minute detail they know, if you do this qualitative study, but they may not be consistent. Okay, and another thing is there is a lot of repeatability happening in qualitative aspects. So one has to know both the qualitative aspects of dealing with the data and also the quantitative aspects of dealing with this data. Then we'll come to know the hybrid forecasting. So hybrid model combine the both of both. no, best of both the worlds, the quantitative accuracy also and the qualitative insights also. So just having the data is also of not much use unless you have a qualitative insight to that data. So you have to collect all the data, write below that data a lot of things. For example, hospital might use a regression model for the baseline demand and adjust it as per the expert input. So you have to write expert inputs also. How many experts have told what number of things below the quantitative data. So this will help the model to increasingly use in complex healthcare settings. Okay. So nowadays, when the life becomes complex with a lot of heat waves, or let us say global warm green gas effects, or sudden changes, or any kind of things, in those cases one has to have both aspects of managing the hospital. One is quantitative accuracy, as another was qualitative insight. So only those areas which have been able to handle those things are able to manage any kind of unforeseen circumstances. So judgment is essential. So they improve the forecast robustness. Okay, they will definitely improve the forecast robustness and adaptability. So this is most important, adaptability according to the changing conditions. So what kind of challenges and applications in forecasting is, first one, data challenges. Very poor data. If you tell somebody to collect the data in India, either they will leave it half hearted or they will not complete the data, and you'll have incomplete records and inconsistent report hindering the accurate forecasting. Point number one, data challenge. Second is uncertainty challenges. First is sudden changes in policy, or sudden changes in understanding the language, or sudden changes in understanding what has caused the pandemic, or what are the solutions for that pandemic, or how the public health events are introduced, about educating the entire thing. Or people will see with a lot of skepticism, or they will look at it with a lot of unintended risk, and it will lead to unintended consequences. So in order to avoid these unintended risk and consequences, one should face all the three things: how much of data of the hospital has, how much of uncertainty is going to face in the future, in the next coming 6 months or 1 year or something like that. What kind of policy adjustments do we have in place? Okay, if you have a lot of policy in place, then it solves half of the problem, and people are on the same page. If you don't have any policy, then again the problem will emerge, and common challenges cannot be understood easily. So one has to have under the volatile, uncertain changes which is happening all the time. So applications in staffing also can happen. So forecasting helps us in staffing, budgeting, and infrastructure planning. So forecasting is essential for staffing to ensure that adequate coverage during the peak times is happening. Lot many staff are there. Whenever whatever happens, we have enough staff. Then it's supposed budgeting by projecting expenses like supplies. So we can hire or borrow certain equipment at times, and we can return it after certain things, after a certain cycles or trends are over. So all these mixing matching of supplies, equipments, and labor, it takes a lot of understanding of planning. So infrastructure plans is expanding a hospital, sometimes being you are increasing A wing or B wing of the hospital, adding a new clinic nearby, okay, or adding so many other restrooms, or having a lot of people who are able to encourage the conversations between all the stakeholders, which is missing in most cases, at least in some states. So we should know these applications ensure that investments are aligned. First of all, whatever investments are there, they should not go waste. Some, if you go to some rural places, the government is sometimes giving too many things, but it is going underutilized. So, for example, for wheelchair and all, or some cars are given to um certain people, of disabled people, and some it's lying like that without being utilized in certain hospitals, or certain areas whereby schools are having so many other facilities, and hospitals are also having so many facilities, but they are lying underutilized because in between there is nobody. So there is a lot of actual patient needs still there, but it is not reaching the particular set of people. So these applications ensure the investments have to be aligned with actual patient needs. Okay, so just investments cannot go waste, basically speaking, and it should also help the future growth. Next comes, the major hospitals, in case, for example, it uses a time series. Let's say it uses a time series forecasting to predict patient admissions during a flu season. Okay, during some flu season, it is reducing the bed shortages by 30%. Okay, that means it has to increase the bed number of beds. It has to increase within a, let us say, instead of 3 beds, you should have 4 beds. So another, you used expert panels and regression models to forecast staffing needs during a pandemic. Another one, instead of increasing bed, they are increasing the staffing. Okay, so these are strategic decisions. Either you increase the staff or increase the bed or increase both the staff and beds. It helps to have a proper resource allocation, because you should have salary also to give all the people. You cannot simply increase the staff without increasing their salary or the budgeting. So a rural clinic uses market research to estimate demand for telehealth services, leading to a 40% increase in patient access. So telehealth services are increased in rural area, because of which people can reach and they can utilize 40% increase they have witnessed over a period of time. So this is just a case and example. It could be ABC, any hospital. So this real world example show that tangible impact of forecasting. So how forecasting helps us is, we can come to a conclusion, that is informed conclusion, that is informed decision making, and all the people, all the stakeholders, right from top to bottom, everyone should know that they are on the same page. Then comes your supply chain management in healthcare. Okay, so one thing is nothing but uh, utilizing supply chain management concepts of medical supplies, or whether they are reaching along with the pharmaceutical supplies, material supplies, so machines, material, along with medical supplies, from the manufacturers to the patients, it should reach in time. That too. So it includes procurement, how to procure, which are the listed vendors, what kind of inventory control they can have, what kind of logistics and distribution do they have, and understanding the effective SAM ensures that critical items like the IVs, medications, the intravenous, these things, and surgical tools, and all those things are available when needed. So to make it available is the biggest challenge, because it's not readily available unless you know what's the demand, and accurate forecasting is required in order to know the demand properly. And once it is there, from the nearest point, you should transfer it from point A to the hospital. So it directly impacts the patient safety, because it's something which is always required suddenly. So like for example, somebody calls, they want blood. So if you have a blood bank, then you can go and check. And if you don't have a certificate to give, then again the person has to, at least in some remote localities, very challenging, but in metro town cities, and still you have a lot of chances to get access to all those things. So first of all, the supply chain management helps us to assure that medical supplies, equipment, pharmaceutical from manufacturer to patient reaches normally, smoothly. And finally, there's a continuity. This assures that operational continuity is being managed. Then you have a planning phase. In what happens really in planning phase means, planning ensures demand is matched with supply. That's all, nothing much to tell. So planning is nothing but wherever there is a demand, there should be supply over there. Next is sourcing. Then sourcing involves selecting reliable vendors and negotiating the contracts. So, negotiating the terms and conditions, like how it will be installed, where it has to be delivered, what kind of packing and unboxing it will go through, what kind of understanding people should have, what kind of training they have to undergo. All those things are mentioned in the terms and conditions. And according to terms and conditions, something new, which is very complex machine, has to be bought, because blindly what we cannot buy, just like we are buying it for uh, our own houses, whatever equipments we need, we cannot buy it for the hospital because it's very expensive. And again, such requirements will increase over a period of time. So sourcing phase is where people will try to influence with their own friends and family members or relatives. So people, what happens during sourcing phase is, they will try to influence and want to buy it from a particular vendor. All those things, middlemen and all those henchmen who are waiting for such sourcing to happen, and it will be diverted. Funds should not get siphoned off and diverted to some other place. So it is very key phase where all of them have to agree together, and so that it will not reach places which are twisting the policies of the hospital itself. So sourcing phase is very important. Next comes is importance of SCM in healthcare. So a well-managed supply chain reduces the stock out. It should not face stock outs. Okay, it should not be having scarce resources, and all at the same time, it should not waste too many things. And a well-managed supply chain, okay, it should lower the cost also at the same time. So all these things have to be managed by the well-managed supply chain. So it ensures the continuity of care by managing the essential supplies. It also ensures that the compliance and regulations on safety standards are being met. In emergencies, resilient supply chain can deliver critical items quickly. That's very, very important. Okay, normal items somewhere or other you can find alternatives, but critical items have to be reaching them quickly. Supply chain is not just about logistics. Okay, not just bringing from one place to another place. It's about planning and organizing mainly. So it's about core competence of operational excellence. Okay, it should serve as a department or center of excellence, and it should be known for that. That whenever you go that to that place, you will get the proper facilities and all those equipments at the same time at a desired level in the number of units as much as required. So people should know, and they can at least have a lot of trust in those centers of excellence. And next one comes your AI and blockchain. So AI is helping you to have the predictable analytics for inventory levels and demand spikes. So in this managing the inventory in the within the supplies, AI helps you to predict demand. It cannot suddenly improve the services, but it can get and gather some information and tell you that what kind of predictive analytics can happen in the future. And analytics is there everywhere. Even your Instagram shows analytics, Facebook analytics will show, LinkedIn analytics are going to show you how many people are you are keeping on meeting every time. So analytics of every application, including the application which is being utilized for formally the hospital is being utilized for demand spikes. If there is sudden demand, what we have to do, how many things we have to purchase, how much of money we should have, and what should be the emerging trend, from where we have to buy, how to select the vendor, what are their terms and conditions, are we able to do all these things in time. So AI and automation will just improve and enhance the facilities. Next comes your blockchain technology. Blockchain improves the transparency. Okay, one you enter into one kind of transaction, the same transactions everywhere it is going to reach. So without any problem, everybody on the same page, they are often. So you don't have to convince every time, just like it happens in certain government hospitals. Every time you have to go and talk to them, overcome the problem, and again you have to go to another counter, you have to stand in the queue. All those things are not there. So once you adopt the blockchain technology, the people who disrupt or people who subvert the entire process, or middlemen who are trying to take away the standards, those things will be removed because of the blockchain. Improves the transparency, and traceability is improved. So where the medicine is coming from, where it was manufactured, okay, what is the expiry date, how long it is going to be there on the shelf. All these things are recorded automatically in the blockchain technology. Even for finance also, finance uses the blockchain technology. Alongside not only finance, where the money has to come from, where the money has to go, where the medicines have to come, and where the medicines have to go. So this blockchain technology will help you to improve the transparency in both the terms, where money is coming from, where medicine is coming from, where equipments are coming from. So all these things, both AI and automation, blockchain technology will help you to solve majority of the transactional issues and the problems which a normal hospital using legacy technologies are still finding faults with the and struggling with day-to-day activities. Next is supply chain models. So what kind of supply chain models is, first of all, lean. It should be whenever there is a demand increase, then only supply has to be increased. That is known as a lean model. Then agile. So you should be flexible enough to cater to the requirements of the patients as and when there is a demand. So it should be flexible and agile. Then just in time, as and when there is a requirement only, you can beg, borrow, and at least take it from the banks or some fundings or EMIs or insurance companies or whatever. So just in time it should be. Next is hybrid model. Okay, so little bit of incremental improvement in terms of continuous replenishment as and when there is a problem. So lean SCM focuses on minimizing waste, of course, and maximizing efficiency. Agile model responds to quickly to adhere to the demand changes. Just in time reduces the inventory cost by delivering supplies. So all the three models you should know, or you can get certification also whenever required. Lean certification is there, agile certification, just in time certification, continuous replenishment. Of course, it doesn't have any certification as such, but then it's a concept adopted from Japanese people. So hybrid models combine multiple approaches for flexibility. First of all, next, continuous replenishment ensures that consistent stock is maintained throughout with real-time monitoring. And each model suits different healthcare settings. Like urban hospitals may require JIT, just in time. Because there are so many people coming from rural areas, so urban hospitals will require just in time. Okay, because they don't have the space to keep everything, so they have to rely on just in time. The hospital cannot become a go down, and they cannot have managed to, on their own. Some part of that has to be outsourced all the time. So JIT is most, well, rural clinics may benefit from lean or agile systems. Okay, so all the time they should have kind of networking which is good for agile systems. Next, so we have seen almost all the things so far in mastering the healthcare inventory systems. One is inventory management. What we have seen previously in supply chain management is that thing which refers to process of tracking, storing, controlling. So these three things becomes important: where they have to track, what they have to store, okay, and how they can control the medical supplies to ensure the availability while minimizing the waste and cost. So these two things will help us. Its primary objective includes the maintenance of optimal stock level, not very much very overstocked, also not understocked, also reducing the stock out should be eliminated. So preventing overstocking also should happen, ensuring the patient safety and supporting efficient clinical operations. So effective inventory management directly impact the patient care and quality and operational efficiency. It also plays a key role in financial planning. Okay, because very important financial planning by reducing carrying costs. Okay, it should reduce the carrying cost from moving from one place to another place. People should not take away all the money available. So the carrying cost has to be reduced, and improving the cash flow of the hospital, which most often than not, the tier 2 cities hospital will not make any profits unless they can manage these two things very well. Because only the ones which are there in the metro cities, they'll make a lot of profit. What about the smaller hospitals? What of middle sized hospitals? They should manage their carrying cost, and they should have the fund flow and the cash flow statements regularly checked by their experts. So a well-structured system ensures that essential items are available when needed. Otherwise, at the last moment, they will tell you to go to another hospital. When there is a surgery or when there is a childbirth, they will suddenly tell this hospital doesn't have all of this. Then you have to shift suddenly with the ambulance and all. It is not expected for the hospital to do such a mistake, because they should know what they can do, what they cannot do. It could not blindly. It is like it's not. You cannot refuse the patient all of a sudden by telling them to go here and there and run, take a ride of the patient. It should not be done like that. So the proper inventory management will help you to do without compromising the budget constraints. If they don't have the budget, they can speak it off. Their budget is limited. People can look in for other better hospitals, and they should also have safety standards as a part of the routine standard operating procedures. So inventory management is not just keeping things in place or keeping it very shine and clean and keeping it in a very neat and optimal manner. It should also try to see that they have to explain what is there and not what is not there by taking the financial planning as their another objective, which have to mix and match. So there could be a set of things like consumables and disposables, So consumables are what, like gloves. You have the gloves which they wear during surgeries. Then you got bandages which require for the patients as and when they require. Syringes are also there, which are frequently used in small quantity. So these are the typical high turnover and require frequent monitoring to avoid the shortages. So if there is shortage, how can you manage the patient? So one has to know the consumables have to be tracked all the time. It requires a systematic supply chain management and inventory control. Then comes your pharmaceuticals. So all the kind of medicines or medications, including antibiotics, kind of insulins, then you have vaccines that require the strict storage capabilities. So you should have the cool temperature and refrigerators, everything. You should try the expiry date tracking and dosage, because some people end up with giving less or more dosages based upon availability, or generic drugs and all should not be tried and tested. It should be authentic, real drugs taken from authorized dealers. From select vendors, it should be taken, and dosage has to be given properly, because when the medicine changes, even the dosage will change. So, in order to make sure that everything is managed well, these are often time sensitive and they are regulated by health authorities. Okay, the health authorities only are suggesting, and it is regulated. Time to time, you have to create some reports, weekly reports, or monthly reports, and these authorities will also demand all the reports are done in compliance with all the standards. So that calls the health authorities, and understanding their norms and their forms and formats will call for a different session altogether. But pharmaceutical things, supply chain for pharmaceuticals and inventory management for both consumables and pharmaceuticals have to be done cautiously. Next, equipment. So equipment is nothing but all your big machines like your X-ray machine or infusion pumps or surgical tools that are used for less frequently but require long-term maintenance and planning. Who is going to do the AMC, annual maintenance? Okay, so all these things have to be understood and taken care of. Then comes your PPE, which is latest addition during the pandemic, the personal protective equipment which doctors are wearing, nurses are wearing all the time from morning to evening, like masks, gowns, gloves, okay, used during the procedures or the outbreaks, especially during surgeries. And these are critical during public health emergencies, okay, which during COVID they were seen and required rapid replenishment. As and when PP is very expensive, okay, it's a protective gear which the entire body has to be covered, and inside the human being is working in a little more higher temperature, so it requires a lot of hygiene and considerations and all those things. So that's why they have to keep uh, under particular systematic order. So they have to be rapidly replenished as and when required. So importance of effective control. What is all this means? Of course, effective inventory control prevents stock out. First of all, sudden stock out, just like how electricity goes off in certain places like this. If inventory is also losing out, it should not happen often again because people will face difficulties. That's why we keep on listening to news that in certain hospitals, certain things led to deaths or casualties. It should not happen. So all the time, stock out should never happen. Actually, that could delay the treatment and it should not compromise the patient care. So and also importance of effective inventory means it reduces always the lot of wastage which happens over a period of time, and disposable, how to dispose everything off and how to properly handle the reverse logistics and how it is segregated into wet wastage and cold, I mean, and dry wastage for from export unused items, and how to keep these things in a proper flow. So it improves the supply chain transparency and improves the supports better decision making through real time data. Even data for that also required. So even for the disposable and segregation of waste also data has to be there. So it means in kgs, in volumes, like how many kgs of waste is going out, okay, and how much of food has been wasted by the staff members, and how much of all these medical equipments are replaced and given. So all these things, of course, real-time data is required, and compliance with regulatory standards and audit requirements it will come to. So whenever audit is there, at that time the issue will come, that how many things have been handled carefully and how much is going a wastage. So ultimately, it strengthens the resilience of healthcare facilities. Okay, it is going to improve the resilience of healthcare facilities during crisis and routine operations. So that's how. So we have seen. I don't think one has to go through again and again. So it is the same thing again. So challenges healthcare is nothing but facing challenges like high variability in demand, sudden increase or sudden decrease. Such a lot of fluctuation in the demand is one problem. Limited spaces are there. We don't have all the space in the world. We have limited spaces. Okay, and most often they're not. We don't have large hospitals. Is there only in the metro cities. All smaller tier two towns also have only small the space constraints. Then comes to complex supply chains are there. Okay, certain items may not be there. Person has the accompanying person with the patient who moves here and there and try to gauge what is available in the city. He has to move to every nook and corner in order to find out what is not there sometimes. So frequent changes in clinical protocols that has to be managed. So any changes in how to deal with everything, step by step procedures that has to be discussed. That has to be briefing. The briefing has to be taken by the doctor to the nurses. Otherwise, nurses will be thinking that what changes are happening in a particular protocol or standard operating procedure. They will never come to know unless it is done on a day-to-day basis. So data inaccuracies, poor record keeping is something which is always um, affecting in certain hospitals, like poor data and record keeping. They'll think why the data has to be kept at all in the first place. Okay, why at all when everything is happening smoothly, when we know how to take care of this, why this data, record keeping will come. So all those things have to be managed cautiously, and they have to incentivize people who are maintaining good record. They should be given promotion, increment on all those things. How to overcome these inaccuracies, they should incentivize. And lack of integration between the various departments can lead to inefficiencies. So people of coordination cooperation with various departments, okay, it is also having its own effect. So seasonal spikes and pandemics and staff turnover, Okay, so staff turnover means people who are finding better jobs, they'll go to some other country and they'll go to some other hospitals and start working. So staff turnover is also another challenge which is they are facing, and it is a complex environment basically. So additionally, regulatory compliance and need for temperature control, storage, and layers of complexity, everything it affects your inventory systems overall. People who are newcomers, they don't know where is the inventory first of all until there is a handover and takeover done by the previous people in a proper situation shift and with a lot of data involved in this. So healthcare inventory management systems are facing these kind of challenges. So we got two analysis in the last. Okay, one is ABC analysis and VD analysis. ABC is nothing but categorizing into moderate value, okay, high value and all those things. So A is always high value and low volume. Okay, very expensive but very few. That is A is high value and low volume. B is moderate value and moderate volume. Okay, some of them both having lot of uh, so many things are some are having requirements at all the times. But C is volume is high but value is low. So we are having A, B, C kind of analysis which has to be done amongst all the kind of equipments and materials which is being placed. This helps to prioritize the control efforts. Next we have got VED analysis. Okay, so VED is what? What is this VED? V stands for vital, E stands for essential, and D stands for desirable. So VED. So VED stands for another analysis. ABC analysis, VED, vital, essential, and desirable. Some hospitals do not have this desirable. Okay, some other hospitals don't have desirable things. They only have vital and essential, especially in tier two towns. So you should do all this ABC analysis and VED analysis based upon the impact on operations. Vital items are critical to patient care and must be closely monitored. These tools are enabling the healthcare providers to focus on the resources in the most impactful inventory management categories in a particular way. It can be classified all the things whatever is there inside the hospital, you have to classify them according to either ABC and also along with that VD analysis. And there is third thing known as FSN. Okay, that is frequency, stock out, and usage value. Okay, how far equipments or I mean the materials are being frequently used, how many times you are facing the stock out, and how many times they are used actually. So this will often help you to how frequently it runs out of the stock. So it helps identify high risk items needed for immediate attention. And lastly, you are also having HML analysis. One is high, another is medium, third is low. Okay, so we are classifying this in HML analysis. So this HML requires tighter monitoring. Okay, so once you are having this tighter monitoring on this one, while doing the supply chain or inventory management, you will have faster replenishment. You can replenish it very fast. So this is how it happens. So these kind of analysis are the some models which you can uh, you know know all the time. ABC analysis, VD analysis, FSN analysis, and HML analysis. Fine, nice. I suppose this has covered most. Finally, coming to the last slide, EOQ, economic order quantity, and JIT. So economic order quantity determines the optimal order size that minimizes the total inventory cost. Whenever you find you have to order at that time, you don't have to wait for a longer time to order. Whenever there is a proper time, at that time you should have to have in bulk quantity, that is economic order quantity, and it determines optimal order size. It determines. So in under what size, under how many, to reduce the carrying cost, you should have a proper size. When it comes to minimal, then only you should transfer from one place to another. So it balances ordering and holding costs. That's very much important. Holding cost has to be well. Holding cost is sometimes expensive. If you want to keep it in fridge, so fridge becomes too hot if you keep so many items. So holding cost, you should know how many items should be there in fridge. Similarly, balancing ordering cost. Just for one or two things you are going on ordering. So by multiplying ordering, so many times you are doing the ordering, and that time what will happen is you are spending too much of money just while ordering. So J or time also, time, energy, and money, all the three things are wasted during ordering. So JIT, just in time systems reduce the inventory holding by aligning supply with the actual demand, reducing waste and storage needs. So this will help you just in time, especially the larger hospitals in the cities. JIT is required just in time. Whenever there is a demand, only then there should be a supply, and that minimum optimum stock you should have. However, JIT requires high coordination. This is what helping you to coordinate very much. So JIT does what is in a larger city, in a metro city, people have to coordinate with each other at a higher level. They should require a lot of coordination because things are less in JIT systems. Okay, you cannot have all the things in storage. As much as there is a demand, only then you can have the supply. So, but people have to coordinate, and they should be reliable supplier networks. People have to have it in the first place in their godowns, and they can be brought at place at the doorstep. Then only, but but the problem with this is it can be risky in healthcare. In this healthcare industry, it becomes risky. Okay, due to the demand unpredictability and emergencies. Fine. So this comes to the end of my presentation. If you got any queries, would like to share your experiences, you are free to do so. Okay, thank you, one and all. I suppose one more class of this subject is there on 13th of next month. Thank you each and everyone for attending this particular class.